For weeks, we've been asking when will North Carolina go into phase 3, but now some health officials are fielding questions about whether that will even happen as scheduled. As the testing increases, both the county and the state are worried about the COVID-19 results that are coming back. In fact, a lot has changed over the past 2 weeks. A graph we have shows from 10 days ago. It has the 4 key measures the state looks at. You'll notice 2 check marks, 1 red X and 1 more neutral symbol. Now here's the updated graph the state presented today. The check marks gone, meaning that we are headed in the wrong direction.
Now it's upon us, every one of us in North Carolina, to say, how can I help keep the virus level low?
Our Joe Bruno is joining us live tonight. Joe, the message from both the state and from Mecklenburg County is that now is really not the time to let our guards down.
Erica, coronavirus is still here. COVID-19 is not going away anytime soon, and leaders want the public to know our numbers are not trending in a good direction.
I am concerned about our COVID-19 trends.
There's not a lot to be happy with right now statewide. Here's COVID-like syndromic cases, a small uptick. Moving on to lab-confirmed cases, a fairly sizable increase. 4 days in the past week with more than 1,000 cases. While an increase in cases was expected due to the increase in testing, health leaders didn't expect it to happen so fast.
We did expect this number to go up, but it's the pace of the increase that is concerning.
The metric that goes hand in hand with that stat is the percentage of positive cases. That's up too, 10%. State health leaders want that rate to be half of that. Right now, it's one of the worst in the country, according to Dr. Cohen. And then there's hospitalizations. They are up. Overall, it is not a report card you'd be proud to show your parents. Governor Roy Cooper called the stats sobering, but he's holding out hope we can enter into phase 2.5 or phase 3 soon.
Insisting on the strategies that reduce transmission, like washing hands, wearing a face covering, waiting 6 feet apart from other people, and tracing the virus to its sources.
In Mecklenburg County, leaders don't share that same optimism.
The way the numbers look right now, I would be surprised if we move fully into phase 3. There may be some additional restrictions lifted, but I really don't have a feel for that yet. The state hasn't given us any specific information on that. I do know that Dr. Cohen is concerned about the numbers.
Daily cases are on the rise, so are the percent positive cases. An average of 10% of people getting tested for COVID-19 are coming back positive. Just about the only thing on the decline nowadays is social distancing, according to Health Director Gibby Harris.
I would love to see us be able to get our kids back into school this fall. But again, a lot of that's going to depend on us as a community and how we manage this.
And Joe, I listened in too on the county and state news conferences, and the one bright spot in all of that was our hospital capacity right now.
Yeah, statewide and in Mecklenburg County, our hospitals have enough room to handle this increase in cases. The one thing, though, to keep in mind, though, is hospitalizations are on the rise in Mecklenburg County. An average of 101 patients were in the hospital daily in Meck County this past week. Erica?
Joe, thank you. Mecklenburg County is working with the state to increase testing for COVID-19. The county already testing about 2,000 people every day, but the state wants the county testing even more, and the two are working together to expand that testing. We know people have encountered some long lines at mobile testing sites, and some people have even been turned away. One man told us he tried to get tested at several locations, but found the wait was close to 3 hours.